Hello everyone. Today we are going to talk about what is the role of nursing staff in handling dysphagia patients. So it is very important to take care of dysphagia patients whenever you are making them to eat something, because as they have a high risk of aspiration. So today we will be segregating it into two types. So first one is oral and second one is non-oral feed. So when coming to talking about the oral feeds, here the patient will be able to eat the diet accordingly, which has been recommended by a dysphagia specialist. So whenever you're feeding the patient orally, make sure that the patient sit in 90-degree sitting position and give a smaller bite, that is less than 3 ml of bolus for every spoon, and give a voluntary pause after every 5 spoons, and do not continuously try to finish one meal in one go, and monitor the saturation levels whenever you're feeding. Make sure that there should not be any other distractions whenever you're feeding the patients. Try to avoid talking and try to avoid all mobile and TV or any other distractions from the patient. After feeding orally, do not try to make the patient lie down immediately. If patient is able to walk, make sure that patient at least walk for 5 minutes. A slow walking is recommended. If the patient is not able to walk, make sure that at least for 10 to 15 minutes the patient remains in the same position, in sitting position, at least a 45 degrees. Okay. When talking about non-oral feed, in non-oral feeds, if the patient is dependent on rice tube or peg dependent, so accordingly, the 2 hours commercial feed will be planned by the dietitian or a dysphagia specialist or a physician. So this commercial feed, make sure that you give it on a right time and all flesh it out once you give the feed. And whenever you're feeding a patient, make sure that the patient should sit in a at least 45 degrees position. Do not feed the patient in completely lying position, and do not give the feed in just 5 or 10 minutes. Do not flush it out immediately after giving the feed, and do not lie down the patient after completing the feed. So make sure that after giving the feed, at least they remain sit in 10 to 15 minutes in the sitting position, and do not give any sort of oral medication without consulting any physician or a dysphagia specialist. If you notice any of the aspiration signs whenever the patient is eating, make sure that you stop the feed and do inform any physician or the dysphagia specialist about the signs, whatever you're noticing whenever you're feeding the patient, so that you can protect the patient from aspiration and save their life.